Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. Ponsegromab for the treatment of cancer cachexia. Background. Cachexia is a common complication of cancer and is associated with an increased risk of death. The level of growth differentiation factor 15, GDF15, a circulating cytokine, is elevated in cancer cachexia. In a small open-label, Phase 1b study involving patients with cancer cachexia, Ponsegromab, a humanized monoclonal antibody inhibiting GDF15, was associated with improved weight, appetite, and physical activity, along with suppressed serum GDF15 levels. See inclusions. Among patients with cancer cachexia and elevated GDF15 levels, the inhibition of GDF15 with Ponsegromab resulted in increased weight gain and overall activity level and reduced cachexia symptoms, findings that confirmed the role of GDF15 as a driver of cachexia. Levofloxacin for the prevention of multidrug-resistant tuberculosis in Vietnam. Background. Prevention of drug-resistant tuberculosis is a global health priority. However, trials evaluating the effectiveness of treating Mycobacterium tuberculosis infection among contacts of persons with drug-resistant tuberculosis are lacking. Conclusions. Although the incidence of tuberculosis was lower in the levofloxacin group than in the placebo group at 30 months, the difference was not significant. Ebola Outbreak Response in the DRC with rVSV-ZEBOV-GP Ring Vaccination. Background. At the beginning of the 2018 to 2020 outbreak of Ebola virus disease, EVD, in Eastern Democratic Republic of Congo, DRC, no vaccine had been licensed. However, cluster randomized evidence from Guinea in 2015 had indicated that ring vaccination around new cases, targeting contacts and contacts of contacts, with the use of single-dose live replicating rVSV-ZEBOV-GP vaccine reduced EVD rates starting 10 days after vaccination. Thus, ring vaccination was added to the standard control measures for that outbreak. Conclusions. Non-randomized evidence. Regarding standard EVD control measures plus ring vaccination in Eastern DRC, reinforces the earlier randomized evidence from Guinea of vaccine efficacy against EVD onset 10 or more days after vaccination. Twice-yearly Depemokimab in severe asthma with an eosinophilic phenotype. Background. Depemokimab is an ultra-long-acting biologic therapy with enhanced binding affinity for interleukin-5 that may enable effective 6-month dosing intervals. Conclusions. Depemokimab reduced the annualized rate of exacerbations among patients with severe asthma with an eosinophilic phenotype. Next, we will be discussing articles from Journal of American Medical Association. 2024 update of the Recover Adult Long COVID Research Index. Question. How do updated data from nearly 4,000 additional participants and expanded symptom questionnaires inform the prior research classification for long COVID, LC, or post-COVID-19 condition? Findings. In this prospective observational cohort study, data from 13,647 adults participating in the Researching COVID to Enhance Recovery Recover Adult study were used to update the research index for classifying symptomatic LC and 5 symptom subtypes that differ in associated demographic features and quality of life, meaning the 2024 LC Research Index may help researchers identify people with symptomatic LC and its symptom subtypes. Refinement of the index will be needed as research advances and the understanding of LC deepens. Next, we will be discussing articles from Annals of Internal Medicine. Risk for financial precarity from hospitalization, implications for targeting financial assistance in Medicare. Background. High out-of-pocket costs in Medicare may leave many beneficiaries in financial precarity. Beneficiaries with modest incomes are often ineligible for Medicaid, which covers most out-of-pocket Medicare costs, and may have insufficient resources to pay an unexpected healthcare bill. This has prompted calls to improve financial protections, but the target population remains uncharacterized. Results. Among 4,881 beneficiaries, population-weighted N equals 26,619,823. 45.0% had insufficient funds in checking and savings accounts to pay the Medicare hospital deductible. Financial precarity was more prevalent among Black and Hispanic versus white beneficiaries, 73.5% and 76.2% versus 36.2%. Those with less versus more than high school education, 70.0% versus 37.1%, and those with 3 or more versus 2 or fewer chronic conditions, 49.2% versus 39.1%. In defining financial precarity to include beneficiaries with insufficient liquid assets to pay the deductible while maintaining a $5,000 reserve for future living expenses, 50.7% were financially precarious. Building off this definition to assume supplemental insurance covered the deductible, 39.0% remained financially precarious. Conclusion. Many Medicare beneficiaries with modest incomes are at risk for financial hardship from costs of a single hospital stay. Next, we will be discussing articles from Lancet. Efficacy and safety of mirikizumab in patients with moderately to severely active Crohn's disease. A Phase 3, multicentre, randomised, double-blind, placebo-controlled and active-controlled, treat-through study. Background. Mirikizumab, a humanized monoclonal antibody that inhibits IL-23p19, is effective in moderate to severe ulcerative colitis. We aimed to evaluate the efficacy and safety of mirikizumab in patients with moderately to severely active Crohn's disease. Interpretation. Mirikizumab was safe and effective as induction and maintenance treatment for patients with moderately to severely active Crohn's disease, who had intolerance, inadequate response, or loss of response to standard. Here are the articles from Journal of Clinical Oncology. Omission of radiotherapy in primary mediastinal B-cell lymphoma. EOSEG-37 trial results. Purpose. The role of consolidation radiotherapy in patients with primary mediastinal B-cell lymphoma, PMBCL, is controversial. Conclusion. This study, the largest randomized trial of radiotherapy in PMBCL, demonstrated favorable outcomes in patients achieving CMR with no survival impairment for those omitting irradiation. Next, we will be discussing articles in the field of gastroenterology. Here are the articles from Gastroenterology. An empirical dietary pattern associated with the gut microbial features in relation to colorectal cancer risk. Background and context. Diet may influence the risk of colorectal cancer through modulation of the gut microbiome, but epidemiologic evidence remains limited. New findings. In this two-phase study with stool metagenomics, dietary, and tumor microbial data, we identified a dietary pattern specifically characterizing the microbial signature of colorectal cancer to be processed food-centered and associated with risk of colorectal cancer, particularly tumors with detectable Fusobacterium nucleatum, PKS plus Escherichia coli, and enterotoxigenic Bacteroides fragilis in tissue. Clinical research relevance. A dietary pattern with a low consumption of processed foods may help prevent colorectal cancer through modulation of the gut microbiome. The dietary pattern modulating the colorectal cancer-related gut microbial signature may particularly help prevent tumoral microbial positive colorectal cancer, which tends to have a worse prognosis. Here are the articles from Journal of Clinical Rheumatology. Evaluating meaningful Changes in patient-reported outcome measurement information system fatigue scores from 3 phase 3 clinical trials of sarilumab for patients with rheumatoid arthritis. Objective. The aim of this study was to evaluate changes in fatigue measured by patient-reported outcome measurement information system, PROMIS, fatigue scores in patients with rheumatoid arthritis, RA, who received sarilumab and to assess the proportion of patients achieving clinically meaningful change. Conclusion. Substantial proportions of patients with RA who received sarilumab reported meaningful change in fatigue measured by PROMIS Fatigue 10A over time. This study demonstrates the ability to convert FOCAT fatigue score onto the PROMIS T-score metric, the rapid reduction in fatigue with biologic therapies, and the use of novel XDA curves to show individual patient-level change. Next, we will be discussing articles in the field of cardiology. Here are the articles from Circulation. NT-proBNP and cardiac troponin I, but not cardiac troponin T, are associated with 7-year changes in cardiac structure and function in older adults, the ERIC study. Background. Higher circulating concentrations of NT-proBNP, N-terminal pro-B type natriuretic peptide, and high-sensitivity cardiac troponin T, HSC-TNT, and I, HSC-TNI, are associated with left ventricular remodeling and with incident heart failure. The associations of these cardiac biomarkers with changes in cardiac structure and function over time are uncharacterized. Conclusions. Higher concentrations of NT-proBNP and HSC-TNI, but not HSC-TNT, were associated with greater declines in left ventricular function over 7 years in late life, independently of traditional cardiovascular risk factors. Here are the articles from Journals of the American College of Cardiology. Twofold more cardiovascular disease events decades before type 2 diabetes diagnosis, a nationwide registry study. Background. The risk of cardiovascular disease, CVD, is increased in individuals with type 2 diabetes mellitus, T2DM, but it remains uncertain how long an elevated CVD occurrence precedes diabetes diagnosis. The aim of this study was to investigate CVD occurrence 30 years before, and 5 years after, T2DM diagnosis compared with matched comparisons. Results. The study included 127,092 individuals with T2DM and 381,023 matched comparisons. In the 30-year period before T2DM diagnosis, 14,179, 11.2%, T2DM individuals and 17,871, 4.7%, comparisons experienced CVD. CVD prevalence was higher in those with T2DM than the comparisons in the entire period before T2DM diagnosis, with ORs ranging from 2.18, 95% C. 1.91 to 2.48 in the earliest period, 25 to 30 years before diagnosis, to 2.96, 95% C, 2.85 to 3.08 in the latest period, less than 5 years before diagnosis. After T2DM diagnosis, 5-year CVD incidence was similarly increased in T2DM individuals versus comparisons, HR, 2.20, 95% C, 2.12 to 2.27. Conclusions. Individuals with T2DM had twofold more CVD events than matched comparisons starting 3 decades before T2DM diagnosis. This indicates that comprehensive preventive strategies may be initiated much earlier in individuals at risk of T2DM. From JAMA Cardiology. Amiodarone or implantable cardioverter defibrillator in Chagas cardiomyopathy. The Chagas 6 randomized clinical trial. Question: Are implantable cardioverter defibrillators, ICDs, more effective than amiodarone hydrochloride for primary prevention of all-cause mortality and sudden cardiac death, SCD, in patients with chronic Chagas cardiomyopathy at moderate to high mortality risk? Findings. This randomized clinical trial included 323 patients, with 157 in the ICD group and 166 in the amiodarone arm. Treatment with ICD did not reduce the primary endpoint of all-cause mortality, but significantly reduced SCD by 72% and heart failure hospitalization by 47%, meaning compared with amiodarone, ICD did not reduce the risk of all-cause mortality, but reduced the risk of SCD and heart failure. Further studies are needed to confirm these results. Next, we will be discussing articles in the field of endocrinology. Here are the articles from Diabetes Care. Relationship of plasma apolipoprotein, CI truncation with risk of diabetes in the multi-ethnic study of atherosclerosis and the OCTOS now for the prevention of diabetes study. Objective: higher truncated to native apolipoprotein, APO, CI proteoform ratios, CI/CI, are associated with favorable cardiometabolic risk profiles, but their relationship with longitudinal changes in insulin resistance, IR, and incident diabetes is unknown. Our results indicate that APOC-I truncation may contribute to changes in glucose levels, IR, and risk of diabetes. Next, we will be discussing articles in the field of pulmonary and critical care. Here are the articles from Chest. Severity of inhalation injury and risk of nosocomial pneumonia. Background: the impact of inhalation injury on risk of nosocomial pneumonia, NP, and IMPO. Interpretation: in this study, among patients with inhalation injury, more severe injury was associated with higher hazard of NP in competing risk analysis. Additional research is needed to investigate mechanisms that may explain the relationship between inhalation injury and NP, and to identify more effective risk reduction strategies. Association of RBC, transfusion thresholds and outcomes in medical patients with acute respiratory failure supported, with extracorporeal membrane oxygenation. Background: the hemoglobin value to trigger RBC transfusion for patients receiving venovenous extracorporeal membrane oxygenation, ECMO, is controversial. Previous guidelines recommended transfusing to a normal hemoglobin level, but recent studies suggest that more RBC transfusions are associated with increased adverse outcomes. Research question: is implementation of different institutional RBC transfusion thresholds for patients receiving venovenous ECMO associated with changes in RBC use and patient outcomes? Interpretation: we observed a decrease in number of RBC units per day of ECMO over time, but changes were not associated temporally with implementation of transfusion thresholds. A transfusion threshold of hemoglobin less than 8 grams/dl was associated with a lower hazard of death, but these findings are limited by study methodology. Further research is needed to investigate optimal RBC transfusion practices for patients supported with venovenous ECMO. Here are the articles from the American Journal of Respiratory and Critical Care Medicine. Association between baseline driving pressure and mortality in very old patients with acute respiratory distress syndrome. Rationale: because of the effects of aging on the respiratory system, it is conceivable that the association between driving pressure and mortality depends on age. Objectives: we endeavored to evaluate whether the association between driving pressure and mortality of patients with acute respiratory distress syndrome, ARDS, varies across the adult lifespan, hypothesizing that it is stronger in older, including very old, 80 years, patients. Conclusions: data from randomized controlled trials with strict inclusion criteria suggest that the effect of driving pressure on the mortality of patients with ARDS may depend on age. These results may advocate for a personalized age-dependent mechanical ventilation approach. Next, we will be discussing articles in the field of nephrology. Here are the articles from Clinical Journal of American Society of Nephrology. Breast and prostate cancer screening by life expectancy in patients with kidney failure on dialysis. Key points: breast and prostate cancer screening were more frequent among patients on hemodialysis waitlisted for kidney transplant. Among patients not waitlisted for transplant, we found that screening rates were generally higher among patients with higher predicted 5-year survival. Among patients not waitlisted for transplant and with the highest predicted 5-year survival, There was a deficit of screening compared with waitlisted patients. Here are the articles from Kidney International Reports. Pilot trial of hydroxychloroquine as add-on therapy in patients with membranous nephropathy. Introduction. Kidney disease improving global outcomes guidelines indicate that glucocorticoids and immunosuppressants comprise the first therapeutic regimens after 4 to 6 months of treatment for high-risk primary membranous nephropathy, PMN. However, some patients cannot achieve complete or partial remission at 6 months. This study aimed to evaluate the efficacy of traditional immunotherapy combined with hydroxychloroquine, HCQ, a well-known immune regulator, in patients with PMN. Results. Baseline characteristics showed no statistical significance between the two groups. However, the HCQ group showed significantly reduced proteinuria compared to standard of care group. A reduced proteinuria was seen at 6 months, 1.2, 0.4 to 2.2, versus 2.2, 1.0 to 3.8, GD, p equals 0.029, and the relapse rate with 12 months follow-up was also significantly decreased in the HCQ group, compared to the standard of care group, 3.7% versus 23.3%, p equals 0.033. Conclusions. HCQ may serve as an effective add-on therapy for PMN. Urine protein to creatinine ratio remains informative, despite non-steady-state serum creatinine during acute kidney injury. Introduction. Experts have cautioned that assessment of proteinuria using urine protein to creatinine ratios, UPCRs, are not valid during acute kidney injury (AKI) because reduced urine creatinine in the denominator may artificially inflate the ratio. However, there is little empiric data assessing this theoretical concern. Results. Among 329 adults hospitalized with stage 2 or 3 A.I.O, defined as peak nadir serum creatinine during hospitalization greater than or equal to 2, at the University of California, San Francisco from January 1, 2014 to December 31, 2022, with multiple UPCRs measured during A.I.O hospitalization. UPCR values were similar whether the serum creatinine was increasing or decreasing at the time of measurement. Median difference, 0.06 grams/g. Interquartile range, IQR, minus 0.26 to 0.50 grams/g. There was no association between the difference in serum creatinine slopes when the UPCRs were collected and the difference in UPCR values. UPCR 0.05 grams/g higher per milligram/dl/d serum creatinine slope. 95% confidence interval, C, minus 0.36 to 0.47, p equals 0.80. UPCR's measures during hospitalization demonstrated positive and negative predictive values, suggesting utility in appraising clinically relevant outpatient UPCR levels. Conclusion. Despite non-steady-state serum creatinine at the time of collection, UPCRs measured during A.I.O hospitalizations may be more informative than previously believed, and should not be wholly disregarded.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.